A lot of people think Tourette syndrome is quite uncommon, but actually it's quite common. It affects about 1% of school children. So we think that overall that's about 300,000 people in the United Kingdom, because adults have it as well, but it tends to get better as people get a bit older in the majority of cases. But everybody with Tourette syndrome actually has it slightly differently. The main feature of Tourette syndrome are what we call tics, which are involuntary movements or noises. And in some people these are so mild that they hardly know they've got them and they'd never have been to a doctor with them. And in other people they can be very severe and can be the main problem for the patient. And the most famous kind of tic, which is involuntary swearing, which is what people think about when Tourette syndrome is mentioned often, it's actually quite uncommon. It's only in about 10% of people with Tourette syndrome, although it's pretty unpleasant for the people that do have it. They don't mean to swear, these words just slip out when they don't want them to. But people who have Tourette syndrome also very often have other less visible features than the tics. So they can have obsessionality, which we call OCD, or obsessive compulsive disorder, and they can very commonly have concentration problems, which is called ADHD, or attention deficit hyperactivity disorder. So in some people they have the main problem is the tics, and in other people they may have mild tics, but the main problem are these other things like the concentration issues or the obsessionality. But I think one of the most important things, particularly for children with Tourette syndrome, is to say that they are likely to improve. So the tics tend to get better with age, and the thing is to hang in there while people are younger so they can get their maximal benefit from their schooling and their social development, so that when the tics are better, they're ready to fully engage in society. And because Tourette syndrome is so variable, people with Tourette syndrome are in all walks of life. There's no area of life in which somebody with Tourette syndrome could not go into, and people shouldn't feel limited because they've been given this diagnosis. We don't really know the cause of Tourette syndrome, but in most people it seems to be inherited, in that if a child has Tourette syndrome, there are usually people in their family, on the mother's or the father's or both sides, who have either tics or other features of the condition. And for reasons we also don't understand, it affects boys about 4 times more commonly than girls. Now, there may be other things which can contribute to people having Tourette syndrome, and this may be difficulties when they're born, for instance, a difficult birth, or the mother having illnesses during the pregnancy, or the mother smoking during the pregnancy, and also infections prior to the syndrome developing, particularly a special kind of throat infection, which may trigger off the immune system in the body to affect the brain to make somebody more likely to develop tics. But how all these possible causes fit together, we're not entirely sure yet. When it comes to treating Tourette syndrome, the first step is to really have an assessment that highlights what the important things are for that person. So for one person, the tics may be the main thing. For another person, their concentration may be the main thing, and the treatments for the different aspects are different. When it comes to the tics, the involuntary movements or noises, various medications can be helpful, but unfortunately this is a bit variable from person to person. So many people will try medication either as an adult or a child and see what they get on with best. There are also psychological treatments for tics. This is a talking treatment that gives people strategies to help hold in the tics, essentially. And in the United Kingdom, we're a bit short of psychologists to try and deliver this treatment, but it is out there and it's very evidence-based, and we hope that more people will have the opportunity for that kind of treatment in the future. People who've been given a diagnosis of Tourette syndrome can really end up doing anything in life. The Tourette syndrome is as variable from person to person as people are from person to person. So for some people it can be a very big challenge because the tics are very much getting in the way, and this may improve as they get older, hopefully, for many of them. And for other people the challenge might be a lot less. But what we aim to do at Tourette's Action is to help people meet that challenge as much as they can to get the most out of life.